Hello, my dear friends. I am myself Dr. Rajesh Guba. I am cardiologist and as well as the tutor or mentor for general medicine for NEET PG, PGI Chandigarh and as well as the AIMS exam. Now, let us discuss the daily dose that includes. We have a 66-year-old woman presents to the accident and emergency department with a 2 days history of shortness of breath. The patient notes becoming progressive shortness of breath as well as sharp pain in the right side of the chest, which is most painful when taking a deep breath. This point is very important. The patient also complains of mild pain in the right leg, though there is nothing significant on full cardiovascular and respiratory examination. Heart rate is around 96 and respiratory rate is 12. And the patient denies any weight loss or long haul flights but mentions undergoing a nasal polypectomy 3 weeks ago. What is the most likely diagnosis in this patient? The options are muscular strain, heart failure, pneumothorax, angina, and pulmonary embolism. Now, so if you see this particular question, the very important points in the history is progressive shortness of breath and as well as the chest pain on the right side, which is increasing on inspiration or respiration. So these are the two important points in the history. Whereas the other important point in the history is mild pain in the right leg, right? So this is third important point. Examination, the vitals are, the heart rate and respiratory rate is almost normal, and even your cardiovascular respiratory system examination is normal, right? So what exactly do you think is the diagnosis? So if you see this question, the answer in this particular question is the pulmonary embolism. Why? I'll tell you. See, you take the other options like muscle strain, heart failure, pneumothorax, angina does not fit into this particular clinical scenario. Very important clinical scenario which is fitting the pulmonary embolism is progressive shortness of breath. Like for example, if there is a massive pulmonary embolism, the individual can present with acute onset of breathlessness. But if the size of the pulmonary embolus is small, then the individual can have the progressive shortness of breath. Whereas you take the other options, like for example, you take the muscle strain. Now, why it cannot be muscle strain? Why it cannot be muscle strain? Because in patients with the muscle strain, they will not have progressive shortness of breath. And second important point, they will not have pain within the leg. So muscle strain is not the correct answer to this particular question. Next. Now, why it cannot be heart failure? Remember, in patients with heart failure, the breathlessness, it will be acute in onset. And not only that, they will have other features of heart failure, like the presence of bilateral leg edema, presence of orthopnea, hepatomegaly. These are some other features of the heart failure, which is not present in the patient. And the other important thing is, in heart failure, they will have bilateral basal crepitations. So that is not there in the patient because respiratory system examination, what he says is absolutely normal. So that is the reason why your heart failure is also ruled out. Now, why it cannot be pneumothorax? Remember, in patients with pneumothorax, they will have acute onset of breathlessness. They will not have gradual progressive breathlessness. And definitely, yes, in pneumothorax, they will have pain on respiration. But the onset of breathlessness is acute in onset and they will not have pain in the leg, and respiratory system examination on percussion in pneumothorax, there will be hyperresonant node. And not only that, there will be absent breath sounds on auscultation, that is respiratory system examination. But in the question, the respiratory system examination is normal. So that is the reason why pneumothorax is ruled out. Now, how can you rule out the other option, that is angina? See, what will be the presentation in case of angina? It's a dull or crushing chest pain, and that is present in the center of the chest. And the individual should be having the risk factors like diabetes, hypertension, obesity, hyperlipidemia. But these particular risk factors are not there in our patient, which is given in the question. So that is the reason why the appropriate diagnosis in this particular patient here is the pulmonary embolism. So in pulmonary embolism, it can be acute onset breathlessness or gradual onset breathlessness which is progressive depending upon the size of the embolus, right? So I hope you might have liked this particular daily dose, and just do follow us for the daily dose questions.